Regulation of blood glucose. Okay. So you have completed carbohydrate metabolism. Whole carbohydrate metabolism has covered. So from your carbohydrate metabolism, you know that glucose is a very important molecule for our body. Okay. So now in this class we will read about the regulation of this blood glucose level. So before going to regulation of blood glucose, at first we have to know about what is the normal level of blood glucose. Anybody? Normal level? This is fasting blood glucose, and another term is postprandial. The value? Postprandial? Yes, 140. So when the question comes that what is the normal blood glucose level, then the answer will be under two heading. Number 1, fasting blood glucose. That is around 70 to 110 unit what? Milligram per dl. Milligram per dl. And for postprandial, up to 140. Up to 140 milligram per dl. Up to 140 means it may be 100, maybe 90, maybe 80, okay, but not more than 140. It will go up to 140. If it remains up to 140, then it is normal, and if it goes beyond 140, then it is abnormal, okay. So when blood glucose level falls below this 70, that means 60, 50, then the condition is called hypoglycemia. Very good, hypoglycemia. When blood glucose level goes above this level, then hyperglycemia. Hyperglycemia. Give an example of disease condition where hyperglycemia is seen. Diabetes mellitus. Very good. Diabetes mellitus. And hypoglycemia can be seen in, hypoglycemia? Yes, starving. Most common cause, starvation. Starvation. Okay. When we take a carbohydrate rich meal, then glucose comes into the blood. Glucose at first absorbed from the intestine, then it comes to into the blood, and the blood glucose level start rising, okay. And the blood glucose level reaches its peak level in 1 hour. After 1 hour, it starts falling. It is time. It glucose level. Okay. Time means 0, 1 hour, 2 hour. This is fasting state, means glucose level near 70. If we take food, then there will be sharp rise up to 1 hour, then there will be gradual falling of the blood glucose level. And after 2 hours, when we take blood sample for postprandial blood glucose, then it reaches up to 140. Why there is sharp rise, then gradually declination? Yes, very good, insulin. As soon as blood glucose level rises, then a signal goes to the pancreatic beta cell and insulin starts secreting. As we all know that insulin is a hypoglycemic hormone, that means it lowers the blood glucose level. So insulin when starts acting, then glucose level gradually falls. Okay. So this happens to the normal blood glucose level. Now why maintaining this normal blood glucose level is important? Because if there is hypoglycemia, that means there is deprivation of glucose. Deprivation of glucose means deprivation of ATP, energy. ATP is very important for our normal cell function and especially for our brain, that is nervous system. In every microsecond, in second, our brain needs ATP. Without ATP, it will not exist. Okay, so if there is deprivation of glucose, deprivation of ATP, then it may lead to coma, and sometimes it may lead to death. So hypoglycemia is very dangerous. Okay, and also hyperglycemia. If hyperglycemia happens, that means if glucose level exceeds 140 and it reaches and it crosses 180 milligram per dl, then what happens? Renal glycosuria. Okay, what is renal glycosuria? There is a renal threshold for glucose and the value is 180 milligram per dl. Renal threshold means up to this level glucose can reabsorb, kidney can reabsorb. Like other molecule, glucose is also filtered through the glomeruli and then again take back. Okay, so up to this limit 180 milligram per dl, kidney or rather tubules are able to reuptake this glucose, but if it crosses 180 milligram per dl, then the glucose will passes through urine. Okay, so there will be renal glycosuria. Or if there is diabetes mellitus, hyperglycemia in long term, in long cases, then there will be damages of different microvascular component, like in eye there will be cataract. Okay, in kidney there will be deposition of kidney, there will be leakage of protein. Okay, different type of complication of diabetes can be seen if the diabetes mellitus is not treated. Okay, that's why hypoglycemia and hyperglycemia both are dangerous for us. So we have to, our body, means our body have to keep this normal limit. Okay, so there must be some mechanism. Okay, so we will discuss about the mechanism. Before going to mechanism, we will discuss that concentration of blood glucose is maintained by two sets of factors. Concentration of this blood glucose is maintained by two sets of factors. The first group are factors that causing addition of glucose into blood. Assume this is our blood vessels. Addition means pouring glucose into the blood. There are some factors which causes addition of glucose into the blood, and in other hand there are some factors which causing leaving of glucose from blood. Leaving of glucose from blood. Okay. So coming to the first point, factors that causing addition of glucose into blood. Can you tell me what are the causes of addition of glucose into the blood? From where glucose comes into the blood? Simple things. Food. Okay, food. That means absorption of glucose in intestinal epithelium. Okay, absorption of glucose. First point is absorption of glucose in intestinal epithelium via which receptor? GLUT and SGD. Sodium dependent glucose transporter and GLUT. Which type of GLUT is seen in intestinal epithelium? GLUT2. Very good. GLUT2. And GLUT4 is seen in? GLUT4? Liver, adipose tissue. My liver, not liver, muscle and adipose tissue. Insulin sensitive receptor, which is insulin sensitive? GLUT4 is insulin sensitive. Only one receptor, that is GLUT4, this is insulin sensitive. Rest are not insulin sensitive. Okay. So, absorption of glucose, GLUT2, GLUT4, these are very catch question for MCQ. MCQ or even in Viva. For Viva, it is generally asked question, and also MCQ, it is important for MCQ. Try to remember that which type of GLUT is in which cell, which is insulin sensitive, which is not. Okay, it's very important. So, number one, absorption of glucose through intestinal epithelium. And second cause of addition of glucose into the blood. Yes, breakdown of glycogen. That means glycogenolysis. Glycogenolysis will give rise to glucose molecule. Okay, breakdown of glycogen. Glycogenolysis. Then again name another metabolic pathway that give rise to glucose. Gluconeogenesis or neoglucogenesis. Gluconeogenesis. And the last point is some hyperglycemic hormone. That means the hormone that causes rises of blood glucose. Name some glucagon, then epinephrine, norepinephrine, glucocorticoid, growth hormone. Okay, cortisone. Hyperglycemic hormone, that is glucagon. Epinephrine, norepinephrine is called catecholamine. Catecholamine means both epinephrine, norepinephrine. Catecholamine, glucocorticoid, etc. So, these are the factors which causes addition of glucose molecule into the blood. Now, we will see that what are the factors that cause leaving of glucose from the blood. Number one, bolo number one ki hobe? Leaving of glucose. Glucose means glucose is utilized. So, utilization of glucose via glycolysis. Most common pathway glycolysis. Glycolysis, utilization of glucose in cell, in every cell. Okay. Number two, second, opposite to glycogenolysis, that is synthesis of glycogen, glycogenesis or synthesis of glycogen. Glycogen synthesis seen in which organ? Liver and muscle. Liver and muscle. This is a storage form of glucose. Now third point, hypoglycemic hormone like insulin. Only one hypoglycemic hormone, insulin. And then আর কিছু? Yes, main factor is lipogenesis. Okay, lipogenesis. Lipogenesis means Lipid synthesis. You have not covered the lipid metabolism. Okay. So when you will read lipid metabolism, then you can see that there is a pathway called de novo synthesis of fatty acid. Okay. De novo synthesis of fatty acid. De novo synthesis of fatty acid, and in this pathway the starting molecule is acetyl CoA. Acetyl CoA comes from not direct glucose. From which molecule? Directly from which molecule? Pyruvate. Very good. Very good. So acetyl CoA, the starting molecule for de novo synthesis of fatty acid is acetyl CoA. So this comes from glucose. Okay. So this is also a pathway for utilization of glucose. Then synthesis of amino acid. Synthesis of different type of amino acid. When you will read amino acid metabolism, then you can see there are various product or derivative of glucose which helps to synthesis of different type of amino acid. Okay. So these are the factors, that is glycolysis, glycogenesis, hypoglycemic hormone, insulin, lipogenesis and synthesis of amino acid. These factors cause leaving of glucose from blood. Okay. So addition of glucose and leaving of glucose. Now we have to balance this, we have to maintain this mechanism. Okay. So we have discussed about the addition and leaving of blood glucose level. Now the next part is what happens in fasting and fed state. Okay. Have you read the fasting and fed cycle? No. Okay. So we will see what happened in fasting state. Fasting state means we have not taken food for at least 8 to 10 hours and more than that. Okay. For 8 to 10 hours we have not taken food. So if we don't take food, then the glucose level will start gradually falling. Okay. But there is some mechanism which prevents the excessive fall of glucose, because excessive fall of glucose means hypoglycemia, and again hypoglycemia is harmful for our brain. So there is in our body there are some mechanism which stops the excessive falling of glucose. Okay. So what are the mechanism? When the glucose level starts falling, then there is activation of, or rather stimulation of, hyperglycemic hormone. As soon as blood glucose level starts falling, then there is secretion of glucagon, glucocorticoid, catecholamines, growth hormone. Okay. The main hyperglycemic hormone is glucagon. Okay. So when blood glucose level starts falling, then there is activation or secretion of glucagon mainly, or other hyperglycemic hormone. And these hormone, they will shows their effect on some metabolic pathway. Okay. So now we see that what are the actions of glucagon and other hormone. In case of glycolysis, what will do? Glucagon activate or inhibit? Glycolysis will be fasting state. Glycolysis will be inhibited. Glycogen synthesis. What about glycogen synthesis? Inhibited, because we need glucose, not glycogen. Okay. So glycogen synthesis will be inhibited. Now glycogenolysis, this will be activated. Neoglucogenesis, activated. Neoglucogenesis. Number 5. For neoglucogenesis, the amino acid will come from breakdown of muscle protein. Protein gives rise to amino acid. Okay, so there will be breakdown of muscle protein. Breakdown of muscle protein to give rise amino acid, and this amino acid will take part in gluconeogenesis. And in the last stage, that means in case of prolonged starvation or fasting, prolonged period, body starts using fatty acid. Fatty acid. And glucose is spared for the brain. Okay, glucose is spared for the brain. It happens in the last stage. Glucose is spared for brain. So what happens in the fasting state? That means 8 to 10 hours we have not taken food, so glucose level has start falling. So excessive falling is dangerous for our brain and other cell. So there are some mechanism which will be activated to regulate this blood glucose level. So there will be as soon as blood glucose level drops, there is a secretion of glucagon and other hyperglycemic hormone. Okay, so these following are the metabolic effect. For glycolysis, it is inhibited. For glycogen synthesis, it will be inhibited, and there will be breakdown of glycogen and neoglucogenesis. For neoglucogenesis, we need amino acid, and this amino acid will come from breakdown of the muscle, and in the last stage, the body will start utilizing fatty acid because glucose has to be spared for our brain. Okay, so this happens in the fasting state. Now coming to the feed state. এটা হয়ে গেছে, মুছে দেবো। What happens in fed state? Fed state means we have taken lots of food, carbohydrate rich food, so the blood glucose level start rising. Here also excessive rise is dangerous for our health, so there is some mechanism to prevent this excessive rise of blood glucose. Okay, so when blood glucose level start rising, then signal goes to the pancreatic beta cell and there is secretion of insulin. Okay, এগুলো কিন্তু লিখবে প্রথমে, তারপরে ওগুলো লিখবে, আমি মুখে বলছি মানে লিখবে কিন্তু। So insulin, when there is increased blood glucose level, then there is secretion of insulin. Insulin from beta cell of the pancreas. And the insulin will show its action over the various metabolic pathway. So what are the changes? For glycolysis, it will activate the glycolysis so that the glucose can be utilized by every cell and it is cleared from blood. Okay, so it will activate glycolysis. Number 2, what will happen to glycogen synthesis? Activation, glycogenesis. It will activate glycogen synthesis because excess glucose will be stored as glycogen in liver and in muscle. Number 3, glycogenolysis. Glycogenolysis will be inhibited. Number 4, gluconeogenesis. Gluconeogenesis will be inhibited. it also channels glucose to synthesis of amino acid. Okay, insulin also channels glucose, excess glucose for synthesis of amino acid. So these are the action of the insulin. So in fed state, when blood glucose level starts rising, then there is mechanism that prevents the excessive rise, as excessive rise is harmful for our body. So as soon as blood glucose level rises, there is a secretion of insulin from the beta cell, and the insulin will show these metabolic changes, so that blood glucose level keeps in within the normal limit. Okay. So we have discussed about the factor causing addition of glucose into the blood, factor causing leaving of glucose from the blood, then what happens in the fasting state, what happens in fed state. Okay. Now we will discuss about the role of endocrine. Role of endocrine means role of different type of hormone. Glucagon. So glucagon is a peptide hormone secreted from alpha cells, and stimulation for glucagon secretion is hypoglycemia. Stimulation is hypoglycemia. So glucagon is a peptide hormone that is synthesized from alpha cell when blood glucose level starts falling. Okay. So what are the effects of glucagon acts via GPCR. GPCR ki? What is GPCR? G protein coupled receptor. G protein coupled receptor. This is a mechanism of action of hormone. There is a separate chapter of a mechanism of hormonal action, and there you can see that this is one of that mechanism, that is GPCR, G protein coupled receptor. For this timing, you just remember that glucagon acts using GPCR. Okay. So by using GPCR, it phosphorylates or dephosphorylates some enzyme, and we know that action of any enzyme that depends whether it is phosphorylated or dephosphorylated. It is different for different enzyme. In some cases, activated form is phosphorylated form, or in some cases activated form is dephosphorylated form. Okay. So you just write that glucagon acts by using G protein coupled receptor, it phosphorylates or dephosphorylates some enzyme to activate or inhibit them. Okay. So what is the effect in case of glycolysis? In glycolytic pathway, it activates which hormone? Which hormone? Activates which hormone? Pyruvate kinase. It activates pyruvate kinase. Pyruvate kinase. What are the key regulatory hormone for glycolysis? Key regulatory hormone? PFK, then phosphokinase, then another is pyruvate kinase. So glucagon, it activates pyruvate kinase. So activation of pyruvate kinase means activation of glycolysis. Activation of pyruvate kinase means activation, inhibition. Inhibition of pyruvate kinase. Inhibition of pyruvate kinase means inhibition of glycolysis. Because glucagon don't promote glycolysis. Okay, glycolysis is promoted by insulin. আমার ভুল হয়েছিল, ঠিক আছে? Inhibition of pyruvate kinase, that means inhibition of glycolysis. And second, it inhibits production of fructose 2,6-bisphosphate. Fructose 2,6-bisphosphate is not a product of glycolysis. Okay, it's a different product which is synthesized by phosphofructokinase 2. In glycolysis, the enzyme is phosphofructokinase 1, but it is different product, but it has an effect over glycolysis. Okay, what does it do? Fructose 2,6-bisphosphate, it activates phosphofructokinase 1. That is the enzyme of glycolysis. So activation of phosphofructokinase 1 means activation of glycolysis. Activation of glycolysis. What glucagon do? Glucagon inhibits production of fructose 2,6-bisphosphate. So inhibition of this means inhibition of the whole pathway. Okay. So fructose 2,6-bisphosphate, it activates phosphofructokinase 1, that is the enzyme of glycolysis, so that glycolysis can be activated. But glucagon inhibits production of fructose 2,6-bisphosphate and thus indirectly it inhibits glycolysis. Okay. So these are the 2 points in the glycolysis which is acted by glucagon. Now coming to glycogen metabolism. Glycogen metabolism. It activates glycogen phosphorylase. Glycogen phosphorylase is enzyme of glycogen phosphorylase. Breakdown or synthesis? Breakdown. Breakdown of glycogen. That means glycogenolysis. Glycogenolysis. This is a key regulatory enzyme for glycogenolysis, and key regulatory enzyme for glycogen synthesis is, this is for breakdown, and for synthesis the main enzyme regulatory step glycogen synthase. Synthase, very simple, glycogen synthase. Glycogen synthase. So it will inhibit glycogen synthase. Okay, glucagon inhibition of glycogen synthesis. So it will inhibit glycogen synthase hormone. That means inhibition of glycogenesis. So activation of glycogenolysis means by activating this glycogen phosphorylase and inhibition of glycogen synthase. Okay, this is the action over glycogen metabolism. Glycolysis, glycogen metabolism. Okay. Gluconeogenesis. Now we will see what will happen to gluconeogenesis. Name the key regulatory enzyme for gluconeogenesis. What are the regulating step and the enzyme? Name the enzyme. Gluconeogenesis. Key regulatory enzyme for gluconeogenesis. অনেক আছে, একটা দুটো নাম বল না। পাইরুভেট কাইনেজ তো গ্লাইকোলাইসিস, পাইরুভেট কাইনেজ গ্লাইকোলাইসিস। গ্লুকোনিওজেনেসিস fructose 2,6-bisphosphate, phosphoenol pyruvate carboxykinase. Okay, phosphoenol pyruvate carboxykinase. In short form, we write PepsiK. PepsiK. Phosphoenol pyruvate carboxykinase. Okay. So it will activate the phosphoenol pyruvate carboxykinase. Okay. It also activates glucose 6-phosphatase. Glucose 6-phosphatase is also enzyme, regulatory enzyme for gluconeogenesis. Glucose 6-phosphatase. Okay. So glucagon activates phosphoenol pyruvate carboxykinase and it also activates glucose 6-phosphatase. These both are the regulatory enzyme for gluconeogenesis. So these are all about the glucagon. Glucagon is a peptide hormone, acts by using G protein coupled receptor. It phosphorylates or dephosphorylates the enzyme to activate or inactivate them, and the effect of glycolysis, it inhibits pyruvate kinase and it inhibits production of fructose 2,6-bisphosphate. And what happens to glycogen metabolism? It activates, the plus means P means positive. Okay, এটা একটা mnemonics, P positive. It activates glycogen phosphorylase and inhibits glycogen synthase. And what happens to gluconeogenesis? It activates both the enzyme, that is phosphoenol pyruvate carboxykinase and glucose 6-phosphatase. Okay, so role of glucagon done. Then Coming to role of insulin. Role of insulin. When there is increased blood glucose level, then glucose will enter into the beta cell via GLUT. কত number GLUT? 2. GLUT 2, and it will stimulate the secretion of the insulin. Okay. And insulin, what does insulin do? In case of other extrahepatic tissue, insulin helps to mobilize the GLUT4, mobilize GLUT4 into the cell membrane. GLUT4 receptor, every receptor is a protein. Okay, so GLUT4 is synthesized into the endoplasmic reticulum because protein is synthesized. Then, so for action, they must be come into the cell membrane. So insulin does this work. Insulin takes GLUT4 receptor to the cell membrane so that glucose can enter into the cell. This is other tissue. That's why it is called that GLUT4 is insulin sensitive, because it can't work without insulin. Okay, insulin will come and insulin will mobilize GLUT4 towards the cell membrane, and then glucose will uptake. Okay, that's why it is called GLUT4 is insulin sensitive. So, and insulin works via tyrosine. The name of the mechanism is tyrosine kinase cascade pathway. You will read details in future. Okay, just for time being, just remember tyrosine kinase cascade pathway. It is a long pathway. For glucagon, it was G protein coupled receptor, and for so the name of the mechanism is tyrosine kinase cascade pathway. Okay, by using this pathway, insulin works. Now we will see what is the metabolic effect. Number 1, for glycolysis, it activates glycolysis, so it will activate the enzyme of glycolysis. So what are the enzymes? It activates, bolo enzyme naam bolo, ekটু আগেই তো বললাম, pyruvate kinase. It activates pyruvate kinase. Then another enzyme, it activates PFK, phosphofructokinase. It activates pyruvate kinase, it activates phosphofructokinase. Then in case of glycogen metabolism, this is opposite to glucagon action. That means GP will be inhibited. GP means glycogen phosphorylase, and glycogen synthase will be activated, just opposite to glucagon. Okay. Now for gluconeogenesis, লেখাই আছে এখানে, it will inhibit phosphoenol pyruvate carboxykinase, it will inhibit glucose 6 phosphatase, and also it will inhibit fructose 1,6 bisphosphatase. Here also it activates for glycolysis pyruvate dehydrogenase. Pyruvate dehydrogenase complex is required for from which product which? Acetyl CoA from pyruvate. Pyruvate to acetyl CoA, that is pyruvate dehydrogenase complex. Insulin also activates this enzyme. For gluconeogenesis, it inhibits phosphoenol pyruvate carboxykinase, it inhibits glucose 6-phosphatase and also inhibits fructose 1,6-bisphosphatase. Okay. So these are the action of the insulin over the metabolic pathway. Now coming to the role of glucocorticoid. Role of glucocorticoid. Glucocorticoid is synthesized in case of chronic stress condition of our body. When body is in chronic stress condition, then glucocorticoid is secreted, and glucocorticoid they activates all the enzyme of gluconeogenesis. Okay, glucocorticoid they activates all the enzyme of gluconeogenesis, and also it activates aminotransferases. Aminotransferases, what they do? They releases amino acid from muscle, okay, so that it can take part into the neoglucogenesis. Okay, so along with activation of these three enzymes, it also activates aminotransferases. Okay, so this is the role of glucocorticoid. Now next, role of catecholamine. Catecholamine is synthesized when body is in acute stress condition. Acute stress means physical exercise, exposure to cold environment or psychological emergency condition. Okay, in this condition catecholamines are secreted, and catecholamines it mainly activates glycogenolysis to give rise glucose molecule. Okay, so catecholamines they are secreted mainly in acute stress condition, that is exercise, heavy exercise, cold exposure, psychological emergency, fight or flight mode. Okay, and it mainly activates glycogenolysis. Breakdown of glycogen means release of the glucose. Okay, so role of endocrine is completed. So if long question comes regulation of blood glucose, then you have to write all the things in details, but it may come as a short note. Then what you will do, you will just put the heading and write all the things in brief. Okay, no, detailing of enzyme is not needed in that case, but if long question comes, then you have to write which enzyme is activated and which is inhibited. And role of endocrine is also come as a separate question, then you have to write all the name of these 4 hormones. Okay, so anyone summarize what are the heading of today's discussion? Just heading. Bolo at first, normal level of blood glucose level, you will write the normal level blood glucose level, then you will write effect of hypoglycemia and hyperglycemia, then you will write the factors that causing addition of glucose into blood, then factors causing leaving of glucose from blood, then fasting, what happens in fasting state, what happens in fed state, then role of endocrine, and at first role of glucagon, role of insulin, role of glucocorticoid and role of catecholamine. Okay, so this is enough for regulation of blood glucose.